Have you ever noticed a small change in your thinking or balance and wondered if it meant something more? One of my patients once shared that she felt slightly off for weeks before she could explain why. I want you to imagine this for a moment. Your body feels mostly fine, yet something quiet is happening beneath the surface. My name is Dr. Evelyn Carter, and I am grateful you are here with me on Senior Health Daily. After decades of caring for older adults, I have learned that the most important health conversations are often the calm ones. Today, we are talking about Nipah virus and why doctors pay close attention to how it can affect the nervous system, especially in seniors. Nipah virus is a rare but serious virus that has drawn medical attention because of its connection to the brain and nervous system. What makes it different is not just its severity, but how quietly it can act. In many cases, what we call silent damage may begin long before obvious symptoms appear. The nervous system does not always sound an alarm right away. Instead, it may whisper through subtle changes in alertness, coordination, or mental clarity. In my clinical experience, many neurological conditions do not start with dramatic warning signs. They begin with small shifts that are easy to dismiss, especially as we age. Simple science helps explain this. The brain is highly sensitive, and inflammation or infection can interfere with communication between nerve cells before a person feels truly unwell. I want to be very clear and reassuring. Learning about this does not mean danger is near. Knowledge is not meant to create fear. It is meant to give you steadiness and confidence. When older adults understand how their bodies work, they are better able to stay calm, ask the right questions, and protect their well-being with dignity. If this kind of gentle, trustworthy guidance matters to you, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue creating calm and helpful health content made especially for you. In the next part, we will take a closer look at how Nipah virus can affect the nervous system and why awareness without fear is one of the most powerful tools for healthy aging. Why the nervous system is vulnerable. When we talk about a virus affecting the nervous system, it can sound abstract, like something that belongs in a textbook. But for older adults, the nervous system is not an abstract idea. It is the quiet conductor of daily life. It helps you wake up and recognize the room you are in. It guides your steps from the bedroom to the kitchen. It lets you find the right word in a conversation. It helps you stay steady when you turn too quickly, and it helps you feel safe inside your own body. That is why the nervous system can feel so personal, and why it can also be so vulnerable, especially with age. In my years caring for seniors, I have seen how small disruptions in the brain or nerves can ripple outward. A person may not feel sick in a classic way. They may not have a dramatic pain or a clear warning. Instead, they might feel a little slower, a little less sharp, or a little unsteady. Many families assume it is just aging, or stress, or poor sleep. Sometimes it is. But sometimes it is the nervous system asking for attention. There are simple reasons this sensitivity increases with time. The brain relies on steady blood flow, healthy connections between nerve cells, and a calm balance of chemicals that support focus, memory, and mood. As we get older, those systems can become less flexible. The immune response can also change. It may be slower to recognize a threat, or it may overreact with inflammation once it does. And inflammation matters because inflammation is one of the ways infections can interfere with the delicate communication between nerve cells. Think of your nervous system like a well-loved piano. It can still play beautifully for decades, but it may not tolerate rough handling the way it did when it was brand new. Even mild disruptions can throw off the melody. That is one reason doctors pay close attention when a virus is known to have neurological potential. It is not about panic. It is about protecting something precious. This is also why silent damage can happen. The nervous system often compensates quietly at first. Your brain works hard to fill in gaps and keep you functioning. You may not notice the change right away, but the people close to you sometimes do. A spouse might say you seem more distracted. A daughter might notice you repeat a question. A friend might see you hesitate on the stairs. So before we talk about Nipah virus specifically, it helps to understand the ground it can affect. When you understand why the nervous system is sensitive in older adults, the rest of this conversation becomes less frightening and more practical because you can recognize what matters and why calm attention is so powerful. How Nipah virus enters the body. When people hear the word virus, they often imagine something aggressive and immediate. In reality, most viruses enter the body quietly and follow very ordinary pathways. Understanding this in a calm way helps remove fear and replace it with clarity. Nipah virus is no different in that respect. Like many viruses, Nipah virus does not appear suddenly in the brain. It first enters the body through basic points of contact, most often through the nose, mouth, or digestive system. From there, it begins its work slowly. The body's immune system usually responds right away, often without you feeling anything unusual at first. This early phase is important because it shows us something reassuring. The body is not passive. It is always working in the background to protect you. In simple terms, once a virus enters the body, it travels through the bloodstream or along nerve pathways, depending on the type of virus and the conditions inside the body. Doctors pay attention to Nipah virus because research has shown that it can sometimes cross protective barriers that normally keep infections away from the brain. This does not happen easily or quickly, and it does not happen in most people. But the possibility is why careful monitoring matters. One thing I often explain to my patients is that the brain is protected by several layers of defense. There is a natural barrier that filters what can reach brain tissue. There are immune cells that patrol constantly. There are also repair systems that work to limit damage. For a virus to affect the nervous system, several things must line up. This is not a simple or automatic process, and that is important to remember. In older adults, the journey can look a little different. Age can gently change how efficiently the immune system responds and how quickly inflammation settles. This does not mean the body is weak. It means it works differently. Sometimes that difference allows a virus more time to interact with sensitive tissues before it is fully contained. That is one reason doctors focus on early understanding rather than late reaction. I want to emphasize something I say often in my clinic. Learning how a virus enters the body is not about imagining worst-case scenarios. It is about understanding the steps so you can see where protection already exists. Most of the time, the body handles these encounters quietly and successfully. As we continue this conversation, keep in mind that Nipah virus is studied closely because of what it can do in rare situations, not because it commonly causes harm. When you understand the path, you can replace fear with awareness, and awareness is one of the strongest tools we have for protecting long-term health and peace of mind. How Nipah virus affects the nervous system. When doctors talk about a virus affecting the nervous system, what they are really describing is a disruption in communication. The brain and nerves are constantly sending signals, much like a network of quiet conversations happening all at once. These signals control movement, memory, alertness, and even the sense of balance that keeps you steady on your feet. When a virus interferes, it does not usually shut everything down at once. It tends to interfere gradually, creating small areas of confusion in that communication system. With Nipah virus, medical research shows that the virus can sometimes trigger inflammation in tissues that support the brain and nerves. Inflammation is the body's natural response to a threat. It is meant to protect. But when inflammation occurs in sensitive areas, even temporarily, it can affect how nerve cells talk to each other. Signals may slow down. Messages may arrive out of order. For an older adult, this can feel like mental fog, slowed reactions, or a sense that something is not quite right. It helps to compare this gently with other viruses people may already be familiar with. For example, many seniors remember having the flu and feeling mentally dull or unusually tired for days or weeks. That experience often comes from widespread inflammation affecting the body and the brain together. In some cases, viruses like shingles can irritate specific nerve pathways, causing discomfort or changes in sensation long after the initial illness has passed. These examples show that viruses do not need to destroy tissue to cause noticeable effects. They only need to disturb the environment in which nerves function. What makes Nipah virus different is not that it behaves violently, but that it has a known ability, in rare circumstances, to involve the central nervous system more directly. Doctors monitor this closely because the brain does not respond well to prolonged inflammation. Even short periods of disruption can feel significant to someone whose nervous system is already adapting to the changes of aging. In my clinical experience, the most important thing to understand is timing. The nervous system often compensates quietly. It adjusts. It works around small disruptions. That is why changes can feel subtle at first. A person might notice slower thinking in the evening or feel slightly unsteady when tired. These are not dramatic signs, but they are meaningful. This does not mean that harm is inevitable. It means the nervous system is sensitive, responsive, and worth protecting. When doctors study viruses like Nipah virus, they do so to understand these mechanisms better, not to alarm the public. Clear understanding allows calm decisions, and calm decisions support the brain in doing what it does best: adapting, healing, and continuing to serve you well through the years. Silent neurological damage explained. One of the most difficult ideas for people to accept about the nervous system is that it can change without announcing itself loudly. Many of us are taught to look for clear warning signs when something is wrong. Pain, fever, or sudden weakness are signals we recognize and respect. But the brain often works differently. It is designed to protect function at all costs, even if that means quietly adapting in ways we do not immediately notice. Silent neurological damage refers to changes that occur slowly and subtly. These changes may involve inflammation, disrupted signaling between nerve cells, or temporary stress on brain tissue. None of these always cause pain. Instead, they may show up as slight confusion, changes in attention, or a feeling of mental fatigue that comes earlier in the day than it used to. Because these shifts are gentle, they are often mistaken for normal aging or emotional stress. In my years caring for older adults, I have seen this pattern many times. A patient may come in because a family member is concerned, even though the patient feels mostly fine. A spouse might say that conversations feel different, or that familiar tasks now take a bit longer. A caregiver may notice hesitation when walking on uneven ground, or a pause before answering a simple question. These observations matter, even when medical tests appear reassuring at first. The reason silent changes can occur is that the brain has an extraordinary ability to compensate. When one pathway is stressed, another can often step in. This is a strength, but it can also delay awareness. By the time changes become obvious, the nervous system may have been working harder than usual for quite some time. For older adults, this compensation requires more energy. Aging brains are wise and experienced, but they may not recover from stress as quickly as they once did. When a virus or inflammation enters the picture, even briefly, it can tip that balance. The person may still function well, but with more effort, and that effort can be tiring. This is why calm observation is so important in senior care. Not every change signals danger, but patterns matter, frequency matters, context matters. When caregivers and older adults learn to notice gentle shifts without panic, they create space for early conversations and thoughtful care. Understanding silent neurological change is not about labeling every moment of forgetfulness as a problem. It is about respecting the nervous system and recognizing that it often speaks softly. When you learn to listen, you give yourself the gift of awareness without fear, and that awareness supports dignity, independence, and long-term well-being. Early neurological changes seniors may notice. As we grow older, it is natural for certain abilities to change. Names may take a little longer to come to mind. Balance may not feel quite as effortless as it once did. These shifts alone do not mean something is wrong. What matters is how these changes appear, and how they fit into the larger picture of a person's daily life. When doctors talk about early neurological changes, we are not talking about dramatic symptoms. We are talking about gentle signals that the nervous system may be under stress. One of the most common is a subtle change in memory. This might look like misplacing items more often than usual or needing extra time to recall recent conversations. It may also show up as difficulty staying focused when there is background noise or multiple tasks competing for attention. Another area people often notice is alertness. Some seniors describe feeling mentally drained earlier in the day, even when sleep has not changed. Others feel moments of mental fog that come and go. These experiences can be frustrating, but they are also informative. The brain uses a great deal of energy to maintain clarity. When its environment is disrupted, even temporarily, that energy demand increases. Balance and coordination can also offer early clues. A person may feel slightly unsteady when turning quickly or stepping onto uneven surfaces. They may hesitate more on stairs or feel cautious in situations that once felt automatic. These changes are often mild and easily overlooked, but they reflect how closely the brain and body work together. I want to be very clear and reassuring here. Noticing these changes does not mean a diagnosis has been made. It does not mean a serious condition is present. These are not labels, they are observations. In medicine, observation is often the first step toward understanding, not toward fear. In my clinical work, I encourage seniors and caregivers to think in terms of patterns rather than moments. Everyone has off days. Everyone forgets things. What deserves attention is consistency. Are changes happening more often? Are they interfering with activities that matter to you? Are people close to you noticing the same things? By framing these experiences as signals to observe rather than problems to fear, we protect emotional well-being. The goal is not to search for illness, but to stay connected to your body and mind. When older adults feel empowered to notice changes calmly, they are more likely to speak up early, ask thoughtful questions, and participate actively in their own care. That partnership between awareness and calm is one of the strongest foundations for healthy aging. Before we continue, I want to pause for a moment and speak to you directly. When I created Senior Health Daily, my hope was to build a place where older adults and caregivers could learn without feeling rushed, pressured, or afraid. Every conversation we have here is shaped by years of listening to patients, families, and the quiet concerns that are not always spoken out loud. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Your time matters, and so does your attention. By choosing to be here, you are already taking a thoughtful step toward protecting your well-being. Sharing this video may help someone else feel less alone in their questions. Subscribing helps us reach more people who need clear and steady guidance. And simply liking the video tells us that this kind of calm conversation is valuable to you. I have spent much of my career sitting across from people who wanted to understand their bodies better, but felt overwhelmed by information that sounded frightening or confusing. This channel exists to change that experience. We focus on clarity, patience, and respect for the pace at which each person absorbs information. As we move forward, remember that learning is not about collecting facts. It is about feeling steady enough to use them wisely. Thank you for being part of this community, and for allowing us to walk alongside you as you care for your health with dignity and calm confidence. Brain health and aging. As the years pass, the brain changes in quiet and natural ways. This does not mean it becomes fragile or incapable. In many ways, an aging brain is remarkably skilled. It carries decades of experience, emotional insight, and learned patterns that help guide daily life. At the same time, the brain's ability to recover from stress can shift, and understanding this balance is an important part of healthy aging. One simple way to think about brain recovery is to imagine how the body heals after a minor injury. When we are younger, a bruise may fade quickly. Later in life, that same bruise may take a little longer to disappear. The brain follows a similar pattern. It can still heal and adapt, but it may need more time and more supportive conditions to do so. From a scientific perspective, this has to do with how nerve cells communicate and repair themselves. Brain cells rely on strong connections, steady blood flow, and a supportive environment to function well. As we age, those connections can become slightly less flexible. The brain is still capable of forming new pathways, but it may do so more slowly. This is why rest, emotional calm, and routine become especially valuable for older adults. Inflammation also plays a role. Short periods of inflammation are a normal part of healing, but prolonged inflammation can interfere with brain communication. In younger bodies, inflammation often resolves quickly. In older adults, it may linger a bit longer. This does not automatically cause damage, but it can make the brain more sensitive to additional stressors, including infections. In my experience caring for seniors, I have seen how strongly lifestyle and emotional safety influence brain health. When older adults feel supported, heard, and unhurried, their brains often function better. Memory feels clearer, attention improves. Balance becomes more reliable. These improvements are not always dramatic, but they are meaningful. This is why conversations about viruses and brain health should always include context. A healthy aging brain is not defined by perfection. It is defined by resilience. That resilience grows when knowledge is paired with calm living, gentle routines, and respect for the body's pace. Understanding how aging affects brain recovery helps reframe the discussion. It moves us away from fear and toward care. The brain does not need alarm to protect itself. It needs patience, understanding, and consistent support. When those elements are present, the nervous system is better equipped to respond to challenges and continue serving you well through every stage of life. Emotional safety and the nervous system. When we talk about the nervous system, it is impossible to separate it from emotion. The brain does not only manage movement and memory, it also processes fear, comfort, and a sense of safety. For older adults, emotional safety becomes even more important because the nervous system responds more strongly to stress than it once did. Anxiety and prolonged worry place a quiet but real strain on the brain. When the mind stays on alert for too long, stress hormones remain elevated. This can interfere with sleep, concentration, and emotional balance. Over time, the nervous system may struggle to return to a calm baseline. Many seniors describe this as feeling tense without knowing why, or feeling mentally exhausted, even on days without physical activity. From a long-term care perspective, I have seen how emotional safety directly influences neurological well-being. Older adults who feel rushed, pressured, or constantly worried often show more confusion and fatigue. In contrast, those who feel supported and understood tend to think more clearly and move with greater confidence. This is not coincidence. The nervous system functions best in an environment that signals safety rather than urgency. Simple science helps explain this connection. The brain has built-in systems that prioritize survival. When it senses danger, even emotional danger, it redirects energy toward protection instead of reflection and memory. For seniors, this shift can be more pronounced. Chronic stress may reduce the brain's ability to focus, recall information, or maintain balance. It can also slow recovery when the nervous system has been under strain from illness or infection. This is why emotional care is not separate from physical care. In long-term caregiving, routines that promote calm are just as important as medications or medical visits. Gentle communication, predictable schedules, and respectful listening all help signal safety to the nervous system. These signals allow the brain to conserve energy and support healing. I often remind caregivers that reassurance is not a luxury. It is a form of care. Sitting quietly with someone, speaking slowly, and allowing time for responses can reduce neurological stress. Over weeks and months, this steady environment can make a noticeable difference in clarity and comfort. Protecting the nervous system means protecting emotional well-being. When older adults feel safe, their brains are better able to adapt, recover, and remain engaged with the world around them. Emotional safety is not about avoiding difficult topics. It is about approaching them with patience, compassion, and trust. The role of caregivers. If you are a caregiver, I want to speak to you directly for a moment. Whether you are a spouse, an adult child, a close friend, or a professional helper, your presence matters more than you may realize. In my years of practice, I have seen again and again that caregivers are often the first to notice when something subtle begins to shift. Caregivers see the patterns of daily life. You notice when routines change, when conversations feel slightly different, or when familiar tasks take longer than they used to. These observations are not small. They are often the earliest clues that the nervous system is under stress. While medical tests provide important information, your steady attention provides context that no scan can capture. Patience is one of the most powerful tools you bring to care. The nervous system responds to calm. When a caregiver allows time for answers, avoids rushing, and creates space for rest, the brain often functions more clearly. I have watched patients regain confidence simply because someone slowed the pace and listened without judgment. Observation does not mean constant worry. It means noticing trends over time. A single forgetful moment is not a problem. Repeated confusion in similar situations may deserve a conversation. Occasional unsteadiness can happen to anyone. Ongoing balance changes are worth mentioning to a healthcare provider. Your role is not to diagnose. Your role is to witness. I also want to acknowledge how emotionally demanding caregiving can be. Many caregivers carry concern quietly, afraid of overreacting or saying the wrong thing. Please know that thoughtful observation is an act of care, not fear. Sharing what you see can help guide gentle and timely support. In long-term care, trust between the caregiver and the older adult is essential. When seniors feel respected and not watched with suspicion, they are more willing to share how they feel. This partnership allows changes to be addressed early and calmly. Your patience protects dignity, your attention protects safety, and your calm presence helps the nervous system feel secure. Caregivers, are not simply helpers. You are partners in health, and your role is one of the most meaningful and quietly powerful parts of aging with grace and understanding. Why knowledge should feel calm. As we come to the end of this main discussion, I want to return to a principle that has guided my work for many years. Medical knowledge should never feel like a threat. It should feel like a light that helps you see more clearly without blinding you. When information creates panic, it stops being useful. When it creates calm understanding, it becomes a source of strength. Too often, health information is delivered with urgency and fear. Headlines focus on worst-case scenarios. Complex terms are used without explanation. For older adults, this can be especially unsettling. The nervous system is already sensitive to stress, and fear can cloud judgment, increase anxiety, and make it harder to listen to the body in a balanced way. In my experience, seniors do best when they are given information slowly, respectfully, and with context. Knowing that a virus like Nipah virus is studied closely does not mean it is common or imminent. It means doctors are doing their work quietly in the background to understand rare risks and protect public health. That distinction matters. When people understand why doctors pay attention to certain conditions, they are less likely to jump to frightening conclusions. Calm knowledge also supports better decision-making. When fear is removed from the conversation, older adults and caregivers are more likely to notice subtle changes, speak openly with healthcare providers, and ask thoughtful questions. They are less likely to ignore concerns out of anxiety or exaggerate them out of panic. Balance creates clarity. The nervous system itself responds to this approach. When the brain feels safe, it processes information more effectively. Stress hormones decrease. Focus improves. Memory becomes more reliable. This is not just emotional reassurance. It is a biological response. Calm environments support neurological health in very real ways. This is why Senior Health Daily exists. The goal is not to overwhelm you with facts or warnings. The goal is to help you feel steady and informed. to remind you that your body is not fragile, but responsive. That aging does not mean helplessness, but adaptation. And that awareness, when paired with patience, can protect both physical and emotional well-being. As we prepare to move into the closing of this conversation, I hope you feel grounded rather than worried. Nothing we have discussed is meant to alarm you. It is meant to empower you. Knowledge should leave you feeling capable, supported, and calm enough to rest. That calm understanding is the foundation for everything that follows. Thank you for staying with me until the end of this conversation. Your time and attention matter, and I do not take either lightly. When you choose to listen with care, you are already doing something meaningful for your health. What we have explored today is not a story meant to create worry. Understanding Nipah virus and the nervous system is a story about balance. It is about learning enough to feel steady, not overwhelmed. Medicine works best when knowledge is paired with calm, and when information helps you feel grounded rather than rushed. To the older adults listening, I want to offer this reassurance. Your body and your brain respond best when they feel safe and respected. They do not thrive under fear. They thrive under patience, routine, and trust. Even as the years pass, your nervous system remains capable, responsive, and deserving of gentle care. Awareness does not mean something is wrong. It means you are paying attention with wisdom. To the caregivers who may be watching, thank you. Your quiet presence, your steady observation, and your patience make a difference every single day. Often, it is your calm support that allows someone else to feel secure enough to heal, adapt, and continue living with dignity. As we close, I hope you carry one simple message with you. Knowledge should bring reassurance, not pressure. Health conversations should leave you feeling capable, not afraid. If you ever need a place to return for calm, thoughtful guidance, Senior Health Daily will be here for you. I invite you to stay connected with this community, not because you feel urgency, but because you value understanding that feels human, steady, and kind. Until next time, take a gentle breath, trust your body, and rest in the knowledge that calm care is powerful.